I want to just take this time for us to have a good understanding or a discussion about the true facts about fentanyl. Fentanyl overdose is very overwhelming and is a huge concern here in the United States, and I'm sure it is abroad as well. So this is a reason for us to have a shared mental model about what is fentanyl and all the facts pertaining to the drug. Fentanyl is a synthetic drug that's been created in a lab. It's 50 to 100 times more potent than morphine. It is widely used, and in fact, it's a major game changer in drug abuse, but definitely not a new drug here in the United States. And in fact, it's used mostly for traumatic type of pain as well as severe pain. Many doctors prescribe it only for those reasons. Fentanyl was first developed in 1959 and was used in the United States in 1960. It is legally manufactured in the United States. However, the illegal fentanyl that many people are getting their hands on are manufactured in foreign labs and smuggled into the United States through various countries. The common names are Apache, China Girl, Chinatown, Dance Fever, Friend, Goodfellas, Great Bear, Man, Jackpot, King Ivory, Murder 8, Tango, and Cash. There are a lot of street names for fentanyl. The different forms of fentanyl consist of the dosages, which are referred to as fentanyl lollipops. You have the tablets, some that goes under the tongue, sublingual. You have the nasal sprays, the transdermal patches, and the injectable forms. But keep in mind that many of these forms, if not all, can be purchased on the street and has been enhanced or altered in some way. When you look at the side effects of fentanyl, they're really consistent with other opioids. You will find a person using fentanyl could have one of the following side effects: drowsiness, confusion, constipation, weakness, dry mouth, constricted pupils, unconsciousness, slow respiratory, nausea, vomiting, flushing, discoloration in the hands, lips, difficulty concentrating, sometimes difficulty breathing, as well as tightness in their throat. A little bit about how fentanyl affects our brains. Fentanyl binds to the receptors in our brain that affects pain and our emotions. This causes a feeling of euphoria or well-being and relaxation, and it also relieves pain. Just keep in mind that fentanyl affects everyone differently. So you may have people that are fentanyl dependent that have different weight sizes. They also have an overall different state of health. It is no way to just look at someone and say, yes, you may be or you are using or abusing fentanyl. The other thing that to keep in mind is that it all depends on how much the person is taking. Are they taking it with any other medication? And also their tolerance. Are they used to taking opioids? You know, if they are used to taking opioids, that could impact the effects of the medication. Why fentanyl is abused has a lot to do with the fact that it is 50 to 100 times more potent than morphine. It's highly addictive. Now, the ways that people are actually using it, they can take it orally, smoke it, snort it, inject it, or place it under their tongue. So there are many ways a person can actually use fentanyl. Another thing that makes fentanyl really dangerous is the fact that it can be used with other drugs. Many times heroin as well as cocaine are laced or mixed with fentanyl. Hence the reason why many people don't know what they're really getting. This really places them at a high risk for accidental overdose. I know it may seem like it is something that doesn't happen, but overdoses aren't intended most times. There are accidental overdoses. Many times it's happened when you have one drug that you think you're taking purely and it has been mixed with fentanyl or vice versa. In terms of how we can treat fentanyl, Narcan can be used as an adverse effect on the fentanyl. So if you haven't had any exposure to Narcan, definitely go out, get some Narcan, because I'm the type of person that I'm very much worried about our community. And I'm not just thinking about the people in my immediate family. If I see someone, encounter someone, they're down, they have any of the symptoms, dial 911 first, and then administer the Narcan. In addition to Narcan, we want to definitely, if we can, and we know that a person is in harm's way, want to get them some cognitive behavior therapy. And that works on changing the behaviors as well as the triggers. You also want to do some drug testing, hold the person accountable for getting better. I would also encourage them to be a part of Narcotics Anonymous, as well as getting some motivational interviewing, which really addresses the individual unique needs and their conflicting feelings regarding the need to change their behavior. Just a few things about the signs and symptoms for overdose. A person with slowed or shallow breathing or slow heartbeat, cold, clammy skin, discoloration of the lips, unresponsiveness, severe sleepiness, feeling faint or dizzy. These are things that you will encounter with a person that is suffering from fentanyl overdose. Just keep in mind, it doesn't take a whole lot. Even 2 milligrams can be a lethal dose. It all depends on the person's tolerance, their size, and other factors. But too much is too much. A little bit is too much. So definitely any fentanyl without the prescription and the monitoring of a healthcare professional is dangerous. Fentanyl is a very potent opioid that offers pain relief to those that are severely ill and severely in pain. I hope that this information has been very helpful for you. I don't want any of you to suffer from the loss of a loved one, such as Dr. Karen Jackson, seen in the video. If you haven't seen that video, I want you guys to take a look at it because it is definitely a sad story, but a realistic story, and it could happen to you. Until next time.